reverse pre-diabetes, again, when you know that you're pre-diabetic. If you know that you're pre-diabetic and you know that it's keeping you at a constant state of inflammation, it is easy to fix that. It is easy to fix that. Or it is better for you, again, to be diabetic full blown, because again, when you're diabetic, my diabetic patients know that I sit on their neck. I'm like, you need to fix this. You have to do lifestyle modifications, and I have them come in every 3 months, or we start you on medications. If you're not going to be able to do the lifestyle modifications effectively, we're going to start you on medications. Again, there's a risk benefit analysis that goes into it. If you have other health conditions that you're dealing with, so for example, if you're obese, if you're overweight, if you have high blood pressure, if you have sleep apnea, there are other things that we consider before we ever start you on the medication. That is if you're diabetic. If you're not diabetic, we're like, oh, you're pre-diabetic, you need to do lifestyle changes. You literally have to do lifestyle changes to change it. I've seen patients sit in a pre-diabetic state for 5 years, for 4 years, for 3 years. That is not helping you. That is actually hurting you. I've had patients that have been diagnosed as diabetic, and they reversed their diabetes, and they're not even pre-diabetic almost that same year. Because again, you're working towards it, right? There's plenty of information. Again, for those that are subscribers to me, I have plenty of information that you can use to read. I have guides on what to eat, what not to eat, especially if you're from the immigrant community. What not to eat, what to eat, how to prevent yourself from getting diabetic, from becoming fully blown diabetic, or how to reverse your pre-diabetes, how to reverse your insulin resistance. It is very easy to do, but again, you have to be conscious. You have to know that's what you're dealing with to be able to effectively work on it. Whenever you go to your provider and you do blood work, ask for a copy of your blood work, right? Ask for a copy of the blood work and make sure that you look at the A1C. Again, the A1C, for you to be considered as pre-diabetic, your A1C has to be greater than 5.7 and less than 6.5. For people that are in those ranges, are what I always call like the neglected community, because you're just told you're pre-diabetic. You're not diabetic. It's not diabetes. You're just pre-diabetic, and people say, oh, it's fine. It's not fine. It's not fine. That's why I came live today, because I've noticed the trend. I've had patients that have been pre-diabetic for years. They're just pre-diabetic